Hi, everybody. This is Dr. Delpassand. I'm Chairman and Medical Director of Excel Diagnostics and Nuclear Oncology Center in Houston, and also a sponsor representative of clinical trial using Pb212-DOTAMTATE as targeted alpha therapy for treatment of PRRT progressed patients with neuroendocrine cancer, somatostatin receptor expressing. So the purpose of this presentation is just to tell you a little bit about the AlphaMedix or Pb212-DOTAMTATE, how it works, and also talking about eligibility criteria for this clinical trial. So whoever is interested in participating in this clinical trial, they can look at this video and get the basic information about the eligibility criteria, where we are offering these treatments at this point, and also seeing some of the results that we have at this point. So this slide shows a decay scheme of Pb212, which we call it the in vivo generator, because Pb212, after radiolabeling, after the drug is manufactured, is injected into the patient intravenously. And then inside the body, it changes to Bismuth-212, which is an alpha emitter. In addition to that, we have Thallium-208, which is a gamma emitter, and it allows us to do imaging as well as dosimetry in our patients. So this is in very summary, at a very high level, the decay scheme of Pb212, which is an in vivo alpha emitter. So this is the inclusion criteria for our study. Obviously, all patients, they need to sign a consent form. Patients, they need to be 18 years or older. In terms of the functional studies, we want ECOG of 0 to 2. Basically, what this means is that we want patients that with a little help, they can do their daily personal work, and they are mobile, and essentially their clinical condition is in a way that they can participate in a clinical trial. We mentioned the life expectancy at least 12 weeks. Obviously, majority of the patients, they have a lot longer than this life expectancy. We need to have a pathology report showing the neuroendocrine tumor, and of course, by imaging, by PET imaging, whether copper dotatate or gallium dotatate or any approved FDA PET study showing expression of the somatostatin receptors in the tumors. By anatomical imaging criteria, we need at least one lesion that is more than 1 centimeter. So this is the criteria that is used for what we call it the RECIST criteria, which is radiological evaluation of the soft tissue tumors. We talked about the PET imaging that needs to show somatostatin receptor expression on the PET. Also, we want the patients to have used other FDA-approved treatments for neuroendocrine tumor, including the PRRT. This is a cohort that we accept the patients who have had prior up to 4 cycles of lutetium dotatate PRRT. So if the patient has had some other types of PRRT or more than 800 millicurie, which is 4 cycles of the lutetium dotatate, they will be excluded at this point. Any hypersensitivity to gallium or actinium is an exclusion. It is very unlikely that we have any hypersensitivity to gallium or copper, etc. If there is anything, it's very transient, but it is very rare to see any hypersensitivity. Of course, patients before treatment, as usual, they receive amino acid infusion to protect the kidneys. If they are using sandostatin lanreotide or sandostatin long-acting, we need at least 4 weeks washout period before we can start the treatment. If it's a short-acting, at least 1 day is required before administration of the therapeutic drug. We, of course, do the blood tests on our patients before enrolling in this treatment. And if we see anything significantly abnormal, such as MCV in the blood test more than 105, then we require hematological consult and evaluation before administration of AlphaMedix. I wanted to present the results of the 10 patients that we have done so far. As you can see on the table on the right, these patients have different primary site of the tumor, from a small bowel to pulmonary to pancreatic to even thymus has been the primary site. So in this study, we are not concerned about where the primary tumor has been located or even unknown primary. This is in contrast with the NETHER-1 trial or currently approved indication for the PRRT using lutetium dotatate that only patients with gastroenteropancreatic neuroendocrine tumor are eligible to receive the therapy. In our protocol, all comers, meaning patients with primary tumor in any site of the body can enroll as long as their PET is positive and shows somatostatin receptor expression. In addition, the grade is also another differentiation of our trial with the NETHER-1 trial or the current package insert of the Lutathera. And that is, we are able to use any grade of the tumor as long again as there is somatostatin receptor expression by PET imaging. So as you can see, among our patients, we have had patients with G1, grade 1, grade 2, or grade 3 tumor enrolled in our trial. These 10 subjects, they received a typical effective dose of the AlphaMedix, which is 67.6 microcurie per kilogram per cycle, total of 4 cycles, 1 treatment every 8 weeks. And PET scan that we have been using can be both gallium-68 dotatate or copper-64 dotatate for PET imaging. I show you just a few examples of our patients. On the left, you see the picture, baseline picture on a patient, 81-year-old man with G1 tumor, neuroendocrine tumor of the small bowel, treated in 2017 with 4 doses of lutetium dotatate. There was progression after that. So he was enrolled in our clinical trial. The first therapy was in April of 2020, almost 3 years ago. On the right, you see the PET scan, which was done in 2021. As you can see, there are multiple bulky lesions in the liver. There are multiple lesions in the mesentery. These lesions show significant improvement. For sure, we don't see any new lesion. And this patient, by RECIST, by anatomical imaging, was called a stable disease. But by PET, obviously, we see significant improvement in the disease with no new lesion. The patient is still alive as of today, so more than 3 years after starting the first therapy. The second patient is a 66-year-old man with refractory primary neuroendocrine tumor of thymus, primary. As you can see in the neck, there is an area, there is a lesion in here, and multiple other lymph nodes in the area of the neck and upper mediastinum, axillary regions, and also these bone lesions, as you can see in the lumbar spine, pelvis, and bilateral femur. This patient also received 4 cycles of Lutathera, then progressed in 2017, received the PRRT, and then progressed. In June of 2020, he received the first cycle of the therapy, and the follow-up, as you can see, is in February of 2022. Significant improvement in lesions, as you don't need to be a nuclear physician to see that there are less lesions in the neck and upper mediastinum, axillary regions, as well as in the bones. So this patient, by RECIST criteria, was considered as partial responder, and the patient is alive as of today. The third patient that I wanted to present is a 64-year-old woman with refractory G2, pancreatic primary, treated in 2018 with Lutathera, and then was enrolled in March of 2021 in our clinical trial. On the left, you see multiple lesions in the liver, these black dots in the liver. And then after 4 cycles, there is complete resolution of all those abnormalities in the liver. There is for sure no new lesion. These activities in the chest are related to the central line injections or residual activity in the injection site. This is not disease. So this patient, as of today, has complete response with no evidence of progression. And this last patient I wanted to show, 71-year-old woman with G3 pancreatic neuroendocrine cancer. In 2016, the patient had PRRT with Lutathera. She was enrolled in our clinical trial in April of 2021. As you can see, significant disease in the mediastinum, in the chest, in the liver, in the upper abdomen and mesentery. Numerous lesions seen in here, and significant improvement after 4 cycles of AlphaMedix, with significantly decreased the number and intensity of uptake in the chest and abdomen. This patient by RECIST criteria was considered partial responder, and as of today, patient fortunately is alive and doing well with no other therapies. So this is what we call it the Kaplan-Meier test, showing that up to 30 months, still we haven't reached mean progression-free survival, and more than 50% of our patients, actually 70% of our patients, are still without any progression. This slide shows some common side effects related to the therapy. As you can see, majority of the side effects are grade 1 or grade 2, which are essentially clinically not that significant. They can actually resolve. These side effects include fatigue. Alopecia is seen, transient alopecia or losing hair is seen in majority of the patients, but fortunately, it resolves after completion, few months after completion of the treatment. And nausea is seen. Some changes in liver function test was reported, but majority grade 1 or grade 2. Some creatinine increase, which was again grade 1 or grade 2. We see lymphopenia in majority of the patients. This is believed to be as the result of the radiation to the spleen. Clinically, we just watch it. We don't need to do anything. We are more concerned about decreasing neutrophils, which can increase the incidence of infection in the patients, but lymphopenia is not really in this group of patients clinically significant. And of course, we see some grade 1, 2 anemia or decreased hemoglobin in our patients. So in summary, in this limited number of patients, 10 patients as we have reported, this treatment is highly effective and safe in patients who have already received peptide receptor radionuclide therapy or PRRT with lutetium dotatate. And safely this drug can be administered. And I think I was able to show you how effective it is in our patients. In this group of 10 patients, we had 6 out of 10 patients objective radiological response by RECIST criteria, or 60%. If you look at the package insert of Lutathera, NETHER-1 trial showed 13% objective radiological response. Of course, our group of patients are only 10 patients, and we are in the process of enrolling more patients. And of course, we are very interested to know the numbers when the clinical trial is completed. In fact, we see more response by PET imaging, which we think is more sensitive way of looking at the response rate. But currently, all literature as well as regulatory agencies, they like us to report the response rate by RECIST criteria. We didn't see any clinically significant, meaning grade 3 or grade 4 hematologic, renal, or hepatic toxicity. And as mentioned, phase 2 has just started, and we are enrolling patients who have received PRRT before and progressed. We call it a prior PRRT or PRRT progress cohort. This was in summary what we have. We think really we are pushing the envelope in here, and this is great news for our patients. We think AlphaMedix will be a breakthrough because really based on the response rate that and we see, and also the safety profile of this drug, this is a drug that will help thousands of patients, hopefully in the near future after regulatory approval of the drug. Of course, all depends on the clinical trial and the final results, but what we are seeing looks very encouraging and promising. So I wanted to thank our collaborators, our team at RadioMedix at Excel Nuclear Oncology Center, our team at Oranomed, who is the manufacturer of the drug, also physicians and a rapid team that they did dosimetry for us for this clinical trial, and of course, multiple grants that we were able to receive to help us to conduct this clinical trial. At this point, there are 4 sites that they are enrolling patients with prior PRRT in AlphaMedix trial. One is Excel Diagnostics and Nuclear Oncology Center in Houston. Another one is Moffitt Cancer Center in Tampa, Florida. The third one is at Louisiana State University in New Orleans. And the fourth one at the Rocky Mountain Cancer Center in Denver, Colorado. In summary, this is an active clinical trial right now. And if you need more information, please feel free to contact me, and I'd be happy to help you with any questions that you might have. Thank you so much for your attention.